the VOCM Big Land FM radio network.
Welcome back to the program. Let's go to line number 1. Good morning, Kathy. You're on the air.
Hi, Patty. Good morning. I'm a first-time caller, so thank you for taking my call.
I'm glad you called. I read your email. Go ahead and describe the issue.
Thank you. On a Friday afternoon, late Friday afternoon, my husband became ill, and I immediately drove him to the ER in Carbonear Hospital. It's the nearest to us, because given his symptoms, I was suspecting a heart attack, and my fears were confirmed. It was indeed a heart attack, and his doctor said he had suffered one heart attack at home, and while in the ER trauma, he suffered a second heart attack. And to quote his doctor said, massive, massive heart attack. He said it was the big one. So Dr. Zhu is his doctor right now, and he's the one who treated him. So he's stabilized him, and he's been in the ICU now since Friday night. He's comfortable. He's had some issues because his blood pressure is all over the place, and he's on blood thinners. He's had to get nitroglycerin to bring his blood pressure down. But this all occurred after a day and a half waiting. But he's waiting because he has not yet gone into the Health Science in St. John's to the catheterization lab to get his angiogram.
And that's basically to determine what's next for treatment.
Exactly. Right. I mean, that's what we all refer to as the dye test.
Right. Yes, ma'am.
Now, we have a friend of ours who unfortunately had a heart attack, and he entered into the Health Science St. John's with his symptoms, and within an hour at the same time, he went right to the cardiac lab, and he was treated right away, and they did do that test. They were able to put a stent in, and I mean, he was out of the hospital in 5 hours.
Yeah, there's obviously a different playing field or a different level to that playing field depending on where you live in this province. So is the issue wait times for the cath lab at the Health Sciences,
yes.
Or is it about the requirement of different locations? Or is it both?
It's both, and definitely different locations, because I even talked to, we're self-employed, so that's another thing. I mean, we're self-employed. We've been in business for 22 years. My husband's never cost any money to the government. He's never been ill, never had a health problem until this, never entered the hospital for any reason, no medication whatsoever. And, I mean, here he is now. He can't go back to work and contribute to income, but he's costing money on the system by being there waiting. He's waiting. He's able to go and get this test, but it's just that the backlog is so long that he can't get in. But if we lived in the city of St. John's, he would got treatment.
Yeah, and I mean, everybody realizes that when we talk about healthcare, I don't know if we're going to have the same types of services in 10 different locations. It doesn't make it right or just. I just think that that's going to be the way of the world as we regionalize some services. That includes health. The issue gets bigger than that when we talk about the prevalence of heart disease in this province, the numbers of people waiting, the fact that your health deteriorates as you wait for the dye test to determine what the next course of treatment is. So this is big stuff. The worse your health becomes before you get the test and you get the required treatment, the longer you'll be in hospital, the more time, more costs associated with your stay in the hospital, your lack of opportunity to go back to work, the stress and anxiety on the patient and the family. This is a huge conversation.
It is huge, huge. You said it all. That's exactly what it is. And what happened to the Honorable Minister Haggie? I mean, he was screaming all about the crises in healthcare before he became a minister, but now that he's a minister, he's gone dormant.
I don't know if he has or not. Haggie's been very available to us for conversations regarding mental health and other services here in the province. I don't know. So if you had to ask John Haggie a question directly, what would it be? One question.
Why do we only have one cardiac lab in the province to serve all the province? Why not have one on the West Coast, say Corner Brook? I mean, that way the patients coming from Labrador and on the West Coast, it would benefit them. They wouldn't have to travel way across the island to St. John's. It would free up our lab in town. And why is the lab not open 24/7 as this petition stated that Dr. Zhu has started? I would like you to put that on your website.
I did pass it along to the newsroom, and we'll see what we could do with that and get a comment from the minister himself. Is there a plan for a cath lab in the new Cornerbrook Hospital when it's actually built, finally built? I mean, I know the big controversy at the beginning was whether or not they'd have the full suite of radiology services. Is there a cath lab in that plan? I don't know.
I don't know, but it's needed given Newfoundland has the highest population for heart disease in Canada.
Yeah, you could be right. I'll have to do some research on it because I don't know what services are supposed to be included in that new hospital, but it's a fair point. I'll be able to figure that out fairly quickly.
Yeah, exactly. And you're all supposed to be watching our health and watching your stress and keeping your stress level down, but I mean, they're stressing you. He's been in that hospital bed since Friday night waiting to go into St. John's. He doesn't know what damage he has to his heart, if his heart muscles continue to damage, because each time his blood pressure goes up, it's putting them at more and more risk.
Of course. And that has all the trickle down that we just spoke about, whether it be the extended stay in hospital, the effect on himself and you, and all of the related matters. Kathy, I will see if the newsroom can follow up and get a comment from the minister, and I'll try to figure out about what's going to be included in the new Cornerbrook Hospital. That should be easily enough.
Exactly, because, I mean, if you're not wealthy like premiers and former premiers, you can't go out of the province for your health care or your heart care.
Yeah, and current radio hosts.
We're just left to die, basically, because I have heard cases where people have died waiting just to go for a dye test. That is unacceptable.
Well said, Kathy. It's a big issue. I'm glad you called about it this morning. I wish your husband the best of health, and the same to you.
Thank you. Enjoy your day.
Take care of yourself.
Bye.
Bye. Okay, so there's two things. We'll see if we get the newsroom to follow up on that, and I will figure out whether or not there's supposed to be a cath lab in the Cornerbrook Hospital. But it's the stress on the family, the stress on the patient. And, you know, I do know we're not going to have every imaginable medical service, healthcare service available in every single clinic or hospital across the province. We're not, for a variety of reasons. But when we have issues that are so prominent, heart disease being one, the need to get the dye test done to come up with the next course of treatment is for your ongoing health, and there's a dollars and cents associated with that. So whether or not it's an investment in the human resources and the equipment for a cath lab, compare and contrast that to what would be additional burdens on the healthcare system, extended stays, deterioration of health. It's a good conversation to have. We're happy to have it here on the show. All right, let's go ahead and take a break. When we come back,